Alrighty, so as you guys know, my name is Jesse. I'm going to be giving you guys a speech today on the downside of electroshock therapy. So, first question is, what is electroshock therapy? It's basically a treatment that seizures are induced in patients. It was first introduced in the 1990s, roughly around that time, and it wasn't exactly safe. So what is who is electroshock therapy for? It's more for people with things like severe depression, bipolar disorders, mania or state of euphoria, schizophrenia, and dementia. And it's been proven to sort of help all of these things. So I guess the bigger question would be, does ECT fix these issues? And it sort of does. It's proven that 40 to 60% of patients who go through ECT come back with better results. But during this process, they have to go back multiple times, and it's almost never ending. And other studies have shown that it's not as effective as it has seemed. So why does this matter? I think this personally matters because it's important for anybody to know before they go into medical treatment what they're going into. And it's especially important if it's a loved one or if it's us. Because nobody wants to go into a medical treatment and then get shocked and then not know what's wrong with them or why they have memory loss or why certain bodily functions aren't working because of this particular treatment or any other treatment that they could possibly have. So, as I said before, ECT can be effective for some patients, but it's not always effective. 30 to 40% of people still don't get the help they need, and it's actually been proven to be a bigger number of people who aren't getting the help they need. So, ECT has plenty of underlying issues, even with the new drugs and the new drugs that the doctors use to keep it safe. So after the treatment, the patients receive things like confusion, memory loss, medical complications, and physical side effects. So those are just some of the side effects that are caused by this procedure. So the process of ECT is a consultation, a final checkup, an IV hookup. Then you get dosed with some anesthesia, normally a muscle relaxer. And then the shocks or the seizure is induced by the shocks, and then the patient recovers and goes through the process again. So it's a relatively new study. They don't know what exactly ECT does to the brain. They don't know if they just jumpstart it, which helps these diseases. They don't know if it releases something. And I think that not knowing is a huge issue because of the damage that it could possibly be doing to the patients. So as I said before, ECT is not always a permanent fix and can cause things like short-term memory loss and damage the brain. And I think damaging something like your brain is not exactly something that anybody would really want to do, especially with a experimental process like this. So I think this is more of a call to action because it's important for everybody to understand any procedure that they go through, not just this one, just in general, because that way you know what you're getting yourself into. That way you know what the risks are associated with each procedure. And particularly this procedure has been hugely experimental, and I think that's also a huge factor in knowing a procedure, because you don't want to go into a procedure thinking that it's worked for so many people when it's still not properly understood.